Do you ever feel like you're carrying around a little extra baggage, but it's not in your luggage? Well, you're not alone. Today we're going to talk about something that we all do, but hardly ever talk about. Pooping. That's right, folks. Today we're diving deep into the porcelain throne to uncover why pooping daily is your body's way of saying you're awesome. Good job. So why is using the bathroom daily so important? Well, having a bowel movement every day is considered important for several different reasons, and I'm going to list 9 of them for you today. All right, they're all related to overall digestive health and well-being. Number 1, waste elimination. Your bowels are the bowel's primary way of eliminating waste products and toxins from your digestive system. So regular bowel movements help ensure that the waste is properly removed, reducing the risk of it being reabsorbed into your bloodstream. Number 2, your digestive health. Regular bowel movements can help maintain a healthy digestive system. They indicate that your intestines are functioning well, that food is being processed efficiently, and nutrients are being absorbed properly. This is very important. Number 3, preventing constipation. Daily bowel movements help prevent constipation, which can lead to discomfort, bloating, abdominal pain. Chronic constipation can lead to more serious complications like hemorrhoids, or I'm going to mispronounce this word, anal fissures, and rectal prolapse. Number 4, toxin reabsorption. Prolonged retention of stool in the colon can lead to the reabsorption of toxins and waste products, which can very negatively affect overall health and potentially contribute to some symptoms like headaches, fatigue, and skin problems that you would probably have an issue connecting to your digestive system. Number 5, gut flora balance. Yes, we're talking about gut health. Regular elimination of waste helps you maintain a healthy balance of gut bacteria. So stagnant stools can disrupt this balance, potentially leading to an overgrowth of harmful bacteria and contributing to issues like bloating, gas, and even infection. Number 6, comfort and quality of life. Regular bowel movements can contribute to a sense of well-being and comfort. Irregular or infrequent bowel movements can cause discomfort, anxiety, and even reduce your quality of life. Number 7, constipation can indicate health issues. Regularity in bowel movements can serve as an indicator of overall health. Significant changes in your bowel habits can signal underlying health issues such as gastrointestinal disorders, thyroid problems, or other metabolic conditions. Number 8, hydration and electrolyte balance. Regular bowel movements help maintain proper hydration and electrolyte balance. Stool that remains in your colon for too long can become dehydrated, leading to harder, more difficult to pass stools. Number 9, colon health. Regular elimination reduces your risk of developing a condition called diverticulosis and diverticulitis, which are conditions associated with the formation of small pouches in the colon wall that can become inflamed or infected. Now, let's discuss 9 possible reasons why you may be dealing with some of the conditions we just listed. You ready? Number 1, lack of adequate amounts of fiber. That's right, your body needs fiber. Fiber contains something called prebiotics. Prebiotics are food for good bacteria. The bacteria in your gut have to have something to eat, and in the absence of adequate fiber, they will ultimately begin to eat you. That's right. In the absence of fiber, the good bacteria in your gut will start to munch on the stomach lining. This will allow the contents of your stomach to leak out into your body, causing systematic inflammation. This is very bad news. The fiber in your intestines absorbs water and it creates bulk. This bulk will help the muscles in your intestines push waste out of your body, which can help prevent constipation. Fiber can also help solidify loose stools because, again, it's undigested and it absorbs water. So not only can fiber be a solution for constipation, it can also help with stools that are overly loose. Next, a diet high in fiber can help you prevent and even manage various digestive disorders, including IBS, also known as irritable bowel syndrome, and even hemorrhoids. Fiber helps to normalize your bowel function and prevent the formulation of diverticula in the colon. So in summary, fiber is going to help you improve digestion by adding bulk to your stool. It's going to help with regulating your bowel movements. It's going to promote a healthy gut atmosphere. It slows down digestion, reduces the risk of digestive disorders, and it aids in the elimination of waste. So incorporating a variety of fiber-rich foods in your diet is essential for maintaining digestive health. Number 2, dehydration. This is pretty cut and dry. Without enough fluids, your body's going to have hard stools that are very hard to pass. Number 3, lack of physical activity. That's right. Regular activity helps to stimulate intestinal motility. A sedentary lifestyle can slow down bowel movements, so get up and get some exercise. Number 4, dietary factors. Diets that are high in processed foods or dairy products and low in fruits and vegetables and even whole grains can contribute to constipation. Number 5, certain medications can also contribute to constipation, including opioids, antidepressants, iron supplements, antacids, antihistamines, and even diuretics. Number 6, gastrointestinal disorders. Conditions that affect the digestive system can lead to constipation, as we have discussed. Crohn's disease, ulcerative colitis, diverticulosis. These are conditions that will need to be diagnosed by your doctor. Number 7, endocrine and metabolic disorders can also cause constipation. These are conditions that affect your hormone levels, which affect metabolism and lead to constipation. Conditions like hypothyroidism, diabetes, calcium conditions where your calcium is too high, or potassium levels where your potassium levels are low. These conditions will all cause constipation. Number 8, your liver. The liver can play an indirect role in constipation through several mechanisms related to its function of bile production. Your liver produces a liquid called bile, B-I-L-E, which is stored in your gallbladder and released into the small intestines, and this aids in digestion and the absorption of fats. Your bile also helps to stimulate contractions that move food through the digestive tract. So if your liver is not producing enough bile, or if your bowel is obstructed for any reason, digestion is slowed down, and this will cause constipation. The liver processes and detoxifies various substances as well, including drugs, toxins, and any metabolic waste products. These waste products are excreted into the bile and then into your intestines. So if the liver's detoxification processes are impaired, it can lead to an accumulation of waste products in your body, and this could negatively affect your bowel movements and cause extreme constipation. That means even if you're taking laxatives, you may not exhibit the relief you're looking for because the problem is stemming from your liver. So why would your bowel be inhibited? Well, you could have excess fat accumulating on the liver. This is a condition that is very common now called fatty liver. This is a condition that used to only happen to alcoholics, but now is very common even among children because of the sugar that is so ubiquitous in our food supply now. Sugar has very, very similar effects on the liver as alcohol. Another reason why your bowel may be inhibited is because of excessive alcohol consumption. Alcohol can damage liver cells and reduce bile production significantly. Gallstones can block your bile ducts, preventing bile from reaching your intestines. Certain medications that are metabolized by your liver can also cause constipation as a side effect, as we have already discussed. There are possibly hundreds of reasons related to liver conditions that can lead to constipation. These are just a few. Now, to close out this message, I want to give you a few tips to solve the most preventable and easiest conditions that we've discussed. These are conditions that you can address at home starting today. So grab a pen or pencil and write this down, because it may be just what you need to help you get on the path of having healthy daily bowel movements and completely eliminating some very uncomfortable symptoms. Number 1, increase your fiber intake and minimize processed foods which have very little to no fiber. You can do this by making a commitment to always eating at least one leafy green vegetable with every meal. Make sure the first thing in your mouth every day is a leafy or cruciferous vegetable. Next, cut out fast food. Just set a standard that you no longer eat the stuff unless you literally have no other alternative. We are talking absolute emergencies. Next, train yourself to just buy real food that is not packaged. Avoid foods that are already cooked and instead buy raw meats, buy fresh fruits and vegetables or even frozen fruits and vegetables. And eat healthy carbs like sweet potatoes, beans, lentils, or quinoa. Last but not least, snack on real food like nuts and fruit. But what if your liver is sluggish for some reason and you're not producing enough bile? You'll know this is the case if you've tried laxatives or other natural stimulants like prune juice or apple juice or maybe even bitters and they didn't really work. You want to focus your attention on the liver by incorporating these bile-producing herbs and teas. Milk thistle, yellow dock, turmeric, dandelion root, not the leaf, dandelion root is a much better alternative to producing bile. Barberry. If you've been challenging your liver with lots of alcohol or tons of sugar, you may want to focus on the following remedies. Number 1, an Ayurvedic formulation called Trikatu. Number 2, hydrogen water daily. Number 3, mushrooms and mushroom supplements of all varieties. Number 4, artichoke leaf. And number 5, Shishandra berries. In conclusion, my friends, constipation is not normal, and daily healthy pooping is a sign of good overall health. So be sure to get lots of fiber every day, exercise regularly, stay hydrated, limit the amount of sugar and alcohol you consume, and cut out fast foods and processed foods right away. And remember, a good poop is nature's way of saying, keep up the good work. Good health to us all.